welcome to the third and final of GIC's annual public information sessions for 2022. Thank you all for joining us. We're looking forward to sharing some important information about this year's annual enrollment and the upcoming procurement for our health insurance carriers, as well as some other useful information and resources. We do have CART services available for this session. A link is posted in the chat function for access to that. And I want folks to know that we are also recording these information sessions and they will be available on the GIC's YouTube channel. I also want to welcome the chair of our commission, Valerie Sullivan, and other members of the commission. Thank you all for joining us. So I'd like to start with a quick review of the agenda for today. First, we'll review some of the basics about the GIC as a refresher for longtime members and an introduction for any new members who have joined us today. We'll then move on to health insurance premium rates, where we'll explain our process a bit and our timeline for developing rates, and then share with you what we anticipate that those rates will look like. Next, we'll discuss one proposed change to our health insurance plan design for the coming year, and transition from there to review our upcoming health benefit procurement. The presentation portion of today will wrap up with an overview of retirement and Medicare issues from GIC's Director of Operations, Paul Murphy, and then we'll open it up to questions for participants. We often get lots of questions around retirement issues, so we wanted to dedicate some time to that. So with regards to questions, you may submit them at any time during the presentation via Zoom's Q&A function. Of course, not the chat function, please, but the Q&A function. Some of your questions, we will attempt to respond in writing to as many questions as we can in the Q&A function. We will also be looking for some questions that we think will be of general interest, and we'll answer those during the live Q&A session verbally. So if you have a question that is personal and specific in nature, we want to make sure we protect your privacy, so please utilize the contact form noted in the yellow box, and a member of the GIC staff will contact you directly after the information session. So before we jump into the GIC overview, I want to note at the outset the dates of this year's annual enrollment, as these dates are the context of much of what we'll be discussing here today. So this year's annual enrollment will begin on April 6th and will close on May the 4th. So please plan accordingly. So now we'll move into a brief overview of the GIC, kind of give you a little high-level understanding of how we operate. We'll start with GIC's mission, which of course is to provide our members with high-quality and affordable benefits while driving improved health for members and higher value care delivery across the Commonwealth. So I just want to note the items here that we've bolded. Of course, the heart of what we do is our members. So thank you all for putting your faith and trust in us. So as many of you know, the GIC aims to meet this mission through its coverage offerings, which include a wide array of options, including health insurance, dental, vision, life insurance, and long-term disability insurance. So it really runs the gamut. This slide notes our current health insurance carriers and pharmacy benefit managers. So not shown here, but also our partners for ancillary benefits are MetLife for dental, Davis Vision, of course, for vision, and Benefit Strategies with our health flexible spending account and dependent care FSA. So here are just a couple of key data points about the GIC, including our over 460,000 members. It makes us the largest purchaser of health insurance in the Commonwealth. We are also governed by a 17-member independent commission. The blue box here shows some of the entities with which the GIC partners to offer coverage. And the green box in the lower left shows our annual budget of $2.3 billion. The vast majority of that, of course, being our members' insurance claims. Regarding the GIC's budget, this is just a visual representation of how we're funded. As you can see, a large piece of the GIC's funding comes directly from the Commonwealth of Massachusetts, shown in blue through the state budget. It also includes premium contributions coming from our municipal partners, shown in green, and of course, our members, through your premium payments, are responsible for a significant share as well, here shown in purple. So, noting from the previous slide that the Commonwealth contributes the majority of funding, here we're trying to demonstrate how much of that funding is put to work. So the Commonwealth is a self-insured employer. So this means that it's the Commonwealth of Massachusetts that pays the employer's share of medical claims, regardless of how much we have budgeted for those claims for the year. So it's the Commonwealth of Massachusetts that really holds the insurance risk, not the health insurance plans and not our members. So what that means is if medical claims exceed what we've budgeted, it's the state budget really that picks up those claims, and it does not impact you, our members. The three boxes at the bottom here just attempt to show how claims are actually paid. As a member, you receive your health care from your healthcare provider, and that provider sends a claim to your health insurance carrier. And it's the carrier that essentially acts as an administrator for the GIC, pays the provider for that claim, and then they bill the GIC. We then reimburse our carriers for those claims. So just give you a little sense of how that works. So before we move into the health insurance premium rates, just a reminder that you can submit questions using the Zoom Q&A function at any time during the presentation. As I've noted earlier, we will pull some of those out to address verbally after the presentation. And again, please, if you have a question that's of a personal and specific nature, we want to protect your privacy. So use the contact form noted in the green box here, and we will follow up with you. So here we'll move into health insurance premium rate development. So this is on the next slide is the timeline that the GIC is operating under this year, very similar to prior years. As you can see, we've had an initial presentation to our commission about preliminary rates at our meeting in December, which was followed by a meeting last week where we presented proposed plan design changes, as well as the aggregate financial impact of those changes. Both of those meetings, if you're interested, are available on the GIC's YouTube page. And at the end of the meeting, at our next meeting of the commission on February 10th, we will be voting on plan design changes, and followed by a commission vote on premiums at our March meeting. So when we say preliminary rates that we presented in December, to give you a little sense of what that means, it's the rates as they would be if there were no changes across plans, no changes in our carriers, our funding, and if member enrollment maintained steady across our different plans. So the aggregate expected increase is the average across all of our plans, both Medicare and non-Medicare. However, it is important to note that specific plans will each have their own specific increase, which may fall even outside of this overall range noted below. We will have more to say and more specifics to say to our commission in our March meeting. So this year, we expect an aggregate premium increase across all of our plans of about 5.8%. So next, we'll review some important changes in the insurance market that affect GIC plan offerings. and the plan design changes that we have presented to the Commission last week that I noted, and which they'll be voting on at our February 10th meeting. So one of the GIC's health plans, Fallon Health, as many of you have likely heard, announced last year that they're exiting the commercial health insurance market to focus on their mass health line of business. So as a result of this, Fallon Select and Fallon Direct will no longer be options available to GIC members in fiscal year 23. I want to make clear that this is a decision, it's a business decision made by Fallon Health, not one made by the GIC. Fallon has been a longtime partner of the GIC, and we're sorry to see them go, but they have made this decision in the best interest of their company. So what this means is that any of you who are currently enrolled in these Fallon plans must enroll in a new insurance product during the upcoming annual enrollment, which again begins on April 6th. You will also likely be aware that that members who fail to take that step to enroll in a new plan, if you're in one of those Fallon plans, will be default enrolled into the Unicare Plus plan. So it's important to note here that if you default enroll into Unicare Plus from the Fallon Select plan, that will be a small premium decrease. But if you're enrolled in the Fallon Direct plan, you're looking at a premium increase of about $63. So with that in mind, we really urge GIC members enrolled in Fallon plans, and all of our members actually, to actively shop and enroll in new plans during the annual enrollment. For Fallon members, if you don't do that, you may be default enrolled to a plan that does not meet your needs. At the bottom of the slide here, you may likely have also heard and have questions about the merger of Tufts Health Plan and Harvard Pilgrim Healthcare and what it means to your coverage. I want to assure you that this merger is not likely to impact GIC options in fiscal year 23. It will not affect GIC offerings in 2023. Our Tufts and Harvard Pilgrim products will remain unchanged for the upcoming year. We expect the new merged entity during the upcoming procurement to propose to continue to offer through the GIC even after this year. So for fiscal year 2023, I want to note a few things about our plan designs. This coming year is the fifth and final year of our current contracts with our health plans, of course, save Fallon, who is departing. And as a reminder, in general, we like to preserve the bulk of changes to plans for the procurement process and make only minor adjustments in year-to-year plan design. And that is certainly even more true in the last year of our contracts. So this year we are proposing no changes to copays or deductibles for our members, whether you're in an active or a Medicare plan. We are proposing expanding the behavioral health benefit in a modest way, a small but important change to expand access to important mental health services for children and adolescents. So we have made at the GIC behavioral health a top-level strategic priority, and we acknowledge that the mental health needs of many young members, many young people, are growing dramatically and need to be addressed. So in 2019, the Commonwealth required most health insurance plans to expand coverage for a range of community and family-based mental health services for children and adolescents. These are services that have been traditionally only covered by Mass Health, but were expanded to many private insurance carriers. But at the time, that change did not affect GIC plans. Some of these services are already covered by GIC's carriers, but if the Commission approves the staff recommendation here, we will make sure that the coverage offered by GIC plans is essentially identical to those that already cover most people in private insurance. So you can see the specific services in question here listed at the bottom of the slide. So I want to pause here again just to remind folks that you can submit questions in the Q&A function at any time. Please don't use the chat function, but the Q&A function. We will attempt to address as many of them in writing as we can, and we'll pull out some questions that we think will have a broader interest in the verbal response period at the end. And please, if you have a specific personal question about your coverage, we want to protect your privacy, so use the contact form listed in the blue box. All right, so now that we've reviewed what is upcoming for annual enrollment this year, I want to switch gears a little bit and discuss the upcoming health benefit procurement. So the GIC is required by law to procure new contracts, next slide please, including health insurance carriers, pharmacy benefits, every 5 years. So we're currently heading into year 5, as I mentioned, of this 5-year contract, and we've been working hard to prepare for a new procurement. So here we have a high-level timeline for that process ahead and the work that we've done over the last year. Last year, we focused on gaining feedback from stakeholders, including our members. I'll say more about that in a moment, to help us develop our strategy for procurement. Now that we're in 2022, we're moving forward with drafting a request for responses, commonly called an RFR, which we'll be sending out to our health insurance plans. But we are still very much engaging with members and stakeholders throughout this process, and these information sessions are an important part of that process. So we plan to release the RFR in the spring of this year and review bids that we've gotten back from the insurance carriers over the summer. And we expect to present a recommendation for our commission's vote towards the end of this year, likely in October. Once the commission votes, staff will begin to negotiate with the plans to nail down details and implement new contracts for the new coverage that will start on July 1st, 2023. So it feels like a long way away, July 1, 2023, but for us, it's very much in our minds. We want to make sure we're ready for that. So as I noted on the previous slide, we've been very busy engaging with members and other stakeholders about this procurement. We have 3 main objectives in doing this engagement type work. First, we want to make sure that we are clearly communicating our timeline for this process, the priorities that we have, which I'll speak about in a moment, so that all stakeholders are aware that this process is underway and where we're focusing most of our attention. Second, through these meetings, through these engagements, we are learning and collecting feedback so that we can take all of that information back and have it inform the creation of the RFR that will ultimately produce the new set of health plans. And third, throughout this process, we want to build confidence in the process itself, that we're being responsive to stakeholders, and ultimately that will lead us to the most successful outcome through the procurement later this year. So I mentioned earlier that we talked a little bit about how we've engaged with members. This past summer, we released a survey to our members. It utilized, as you see in the middle here, a conjoint analysis. That is a sophisticated market analysis tool that's used to understand what features of a product or a service that consumers value most. As those of you who took the survey may recall, this it presents participants with often difficult choices and trade-offs about their insurance, your insurance. And this is really by design in order for us to get a real understanding of what features of a plan are most important to you. So we had a very solid response. Thank you all for those of you who took it. It's a very important input among others, but a really important input to the development of our strategy. So let me just say a word about what our takeaways were from the survey. Not surprisingly, they confirm much of what we've heard from members for a while. Our members are most sensitive to changes to out-of-pocket costs, deductibles, and copays. And while it's important to note that the GIC's cost sharing is generally lower than most private insurance, many of our members live on very modest public salaries or fixed income pensions. So increases in copays and deductibles can have a significant impact. We understand that. We also heard that access to a range of hospitals and doctors is important to our members, and that generally you are satisfied with the coverage that the GIC provides. Below those numbers, however, we also understand that among our younger membership, there seems to be more interest than across the average in options that might provide a lower premium. These often include plan design changes that do change cost sharing and access to providers. So you can see how the different findings really start to fit together here. So thank you to those of you who took the survey. We really are grateful for that. It wasn't a simple survey. It was a complicated survey, but health insurance is complicated. So we needed to make sure that we were using a survey tool that acknowledged that. So thank you. So here I want to say a few words about how we're thinking about procurement, describe the areas in which we want to make progress so that we can continue to provide high value benefits to you. So to start, I'll call your attention to the left-hand side of the slide, strategic areas of focus. Of course, top of that list has to be affordability. Across Massachusetts, GIC is no exception. Health insurance premiums are rising faster than the economy overall, faster than wages and pensions for state and municipal public employees. As experts who track the data on these trends understand, health insurance premiums are rising largely because the prices charged by hospitals and doctors is rising. We have the benefit of living in a state with some of the best healthcare in the world, but in order to provide coverage that's affordable, we really must find strategies to address this longstanding and troublesome trend. Second, health equity. As COVID-19 has shown us, inequities in the healthcare system are profound, and they've been around for a very long time, even before COVID-19. And we understand that not all communities have the same access to high quality, affordable care. So the GIC is committed to doing its part to close those gaps and ultimately to provide greater fairness and equity to all of our members. And then finally, behavioral health. As we all know, the need for services for mental health and substance use disorder is rising, and in too many cases, access to these services is not available when it's needed most. Again, I can assure you that the GIC will do all that we can to see that these services are expanded and modernized so that we can close these gaps as well. So in the middle of the slide here, we attempt to bring together our different areas of focus. So we don't look at those three areas of focus in silos. They are all interrelated. So we focus on affordability because it's important as an objective, but also because a failure to address those underlying cost drivers that are making insurance less affordable have a variety of other implications. They make it hard for us to deliver quality insurance to you all. They make it harder for you to be able to spend your income on other things that are important to you other than health insurance. And this is especially important for our members on the lower end of the wage scale. But it also keeps us from making progress on other important goals. I mentioned behavioral health access. We want to strengthen primary care. We want to address health equity. So these are all important objectives. And if we don't address the affordability challenges, it makes it harder for us to make progress in those areas. So then you can see on the right side, I won't go through that portion, but these are the guiding principles that we use to actually develop the request for responses that we are using still. So move on to the next slide. Before I turn it over to Paul Murphy, just another quick reminder that if you have a question at any time, you can post it in the Q&A function here. And if you have a question that is specific in nature, please, we want to protect your privacy. Use the contact form in the blue box. So with that, I'm going to turn the presentation over to my colleague, Paul Murphy. Paul is our Director of Operations, someone who has been with the GIC for over 3 decades. He is a wealth of knowledge and a real treasure to the Commonwealth. We are really lucky to have him on Team GIC. So with that, please go ahead, Paul.
Thank you, Matt, and good morning, everyone. We thought we would add a short presentation this year to the listening sessions, particularly around retirement. We seem to get a lot of questions throughout the year, and especially during annual enrollment. So we thought we'd give some key areas to watch out for members that are thinking about retiring this year, and hopefully address some of those questions or concerns. The first, some general information. If you are retiring this year, anytime throughout the year, and you set a retirement date, it's important that you notify your HR department. The key there is that we want to make sure that you complete the application for retirement for GIC benefits, and that you can transition into retirement with your GIC benefits. Sometimes what happens if people don't work with their HR department, they may terminate you when you leave employment versus switching you into a retirement status. So it's always important to work with your HR department to make sure that they complete their required forms for GIC and transition into retirement. Another area where we get a lot of questions is when people leave the Commonwealth and they start collecting their pension, there's usually a gap in there. It can be anywhere from 3 to 4 months from the time you leave till the time you collect your pension. GIC, during that time, once we receive your retirement information, we will bill you at home monthly for your GIC benefits during that gap. Once we are informed about the pension, GIC will coordinate a deduction from the pension check and stop the monthly billing. So it's important that if you get a bill from the GIC that you pay the bill so that you can avoid any interruption of your coverage. Life insurance. There are 2 policies that the Commonwealth offers to employees. One is called the Basic Life Insurance Policy. You can have basic life in the amount of $5,000, or if you have a health insurance plan with the GIC, that also comes with a $5,000 basic life policy. You can continue the basic life policy into retirement if you elect a health plan. So that will continue. There's no disruption of that. The other area where people get surprised is there's optional life insurance, or sometimes referred to supplemental life insurance. As employees of the Commonwealth, you can purchase up to 8 times your annual salary while you are working. But we want people to keep this in mind that when you retire, the premium for the optional life insurance does increase at retirement. And after age 70, the cost to continue that optional life insurance goes up every 5 years after age 70. So at age 70, 75, 80, etc., the premium does increase to keep that coverage. So we encourage people to look at the optional life insurance when they are thinking about retirement. You don't have to cancel it. It's totally up to you. You can decrease it at retirement, but keep in mind, it's a term policy. There's no cash surrender value. So anything that you have paid into that, when you cancel it, that's it, the coverage ends. One thing to keep in mind is at age 70, 75, 80, the GIC will notify you as a retiree of the new premium and the increase. And before we deduct from your pension check, we will make sure that you are informed of the new premium and you have the option to decrease or cancel that coverage when you receive our letter. So we do notify you before we take these large increases from the pension check. Again, you don't have to wait for the letters. You may cancel this optional life insurance or decrease it at retirement or any time after you retire throughout the year. All you have to do is send GIC a letter advising us that you want to decrease or cancel that life insurance. Dental insurance. we get a lot of questions regarding dental because the Commonwealth offers so many different dental plans. The GIC has a manager's dental vision plan for members that are not covered by collective bargaining or their union plan. The unions also offer a dental vision plan to all of their members. And there's a couple of options that you need to consider if you're thinking about continuing the dental plan into retirement. GIC offers a retiree dental plan to all of the retirees of the Commonwealth. So that is one option at retirement. The other options are to keep in mind when you leave the Commonwealth. If you are insured with GIC's dental vision plan, we will offer you COBRA for that plan. COBRA is 100% of the premium, but the benefits continue after retirement for 18 months, and you will be billed for that premium monthly, but there's no change to your benefit. If you're covered under the union plan, then the union will bill you also, and you have the choice of taking COBRA with the union plan for up to 18 months after you leave. The third option is GIC's retiree dental plan. So you've got a couple of choices to keep in mind. If you choose the COBRA plan, whether it's with GIC plan or through your union, you continue that for 18 months, no benefit change. Benefits are identical as if you were working, but the premium is expensive. Or you can join the GIC retiree dental plan at retirement. The dental plan is administered by MetLife. What you need to do is keep in mind that when you look at this plan, it's a reimbursable plan. So the benefits are different than the plan you may have with GIC or through your union. So you've got to do a little homework and compare. But the option is available to you when you retire. Our retiree dental plan is about $30 for an individual plan and $68 for a family plan under the retiree dental plan. If you choose to keep your dental plan through COBRA with your union or with GIC, at the end of 18 months, you'll be able to jump on GIC retiree dental plan at that point, so there won't be any gap in coverage. If you choose not to take the COBRA plan with GIC or with your union, you can elect a retiree dental plan right at retirement. You have 60 days to elect that. If you choose not to take the GIC retiree dental plan at retirement and you want to think about it, you can pick up that dental plan during any annual enrollment period after you retire. We allow you to come in for that following July 1st, elect an individual or family plan, and you can cover your family members, and we will take the premium from the pension check. One thing to keep in mind is that if you do join the GIC retiree dental plan, if you decide that you want to cancel it after you retire, you are locked out. You can never rejoin that plan once you cancel it with GIC. Health insurance. This is where we get a lot of questions, particularly around people under 65, over 65. First off, keep in mind, if you are a state employee that was hired before 2003, you currently pay a 20% contribution and the Commonwealth pays 80% of that contribution. If you were hired after July 1st, 2003, you pay 25% for your health insurance and the Commonwealth pays 75%. When you retire from the Commonwealth, all retirees as of today pay 20% contribution. So for some of you, the 20% will continue into retirement. For others, your 25% contribution will be reduced down to 20%. For those municipalities that participate with the GIC, you have to check with your municipality to get the contributions, what you would pay for the retiree. Those premiums are set at the municipal level, not at the state level. Under 65. If you're under age 65 when you retire, you can remain in your current plan at retirement. There's no Medicare involved at that point, and you can stay in that plan until age 65. You may also change your plan at retirement. So many times people ask us, what happens if I'm thinking of retiring in December? Do I have to change my plan during annual enrollment? No, you can wait for retirement. And when you retire, that's a qualifying event for you to enroll, cancel, change the family, or change your health plan. So it is a qualifying event. Thereafter, you will have the opportunity to enroll, change plans, or come into GIC during any annual enrollment. So keep that in mind that retirement is a qualifying event. A lot of people say, I'm going to change during open enrollment because I'm going to retire in December. You don't have to do that. You can do it at retirement. If you are over age 65 at retirement, the GIC asks that you check with Social Security. Under state law, if you are Medicare eligible, you have to join one of Medicare plans that the GIC offers. Keep in mind, there's a couple of parts to Medicare that I want to talk about. Medicare Part A is referred to as hospital insurance. It's free. There is no cost to you as the member. Medicare Part B is doctor's insurance. There is a monthly premium for the Medicare Part B coverage, and you have to pay that directly from Social Security, or you pay it out of your Social Security check. Medicare Part D, this is a pharmacy component with Medicare. As a retiree of the Commonwealth, if you have insurance with GIC, you do not need to enroll in the Medicare Part D. All of our Medicare plans offer prescription drug coverage. So there's no need for you to enroll in the Part D prescription drug coverage with Social Security. However, there is a requirement that if you want to retain your insurance with GIC after you retire and you're age 65 or older, you have to elect one of GIC's Medicare supplemental plans. We offer several Medicare supplemental plans. You can choose any of those plans when you reach age 65, or if you are age 65 or older when you retire. One thing to keep in mind is that if you are under 65 when you retire, as you approach age 65, GIC will send you a letter 3 months before your 65th birthday, giving you your options at age 65. We will send you a letter advising you to go to Social Security, enroll in Medicare, and pick one of our Medicare supplemental plans. If you are age 65 or older at retirement, then GIC will send you a letter roughly 3 to 4 weeks after we process your retirement application. You'll get the same letter asking you to go to Medicare and enroll and elect a Medicare supplemental plan. The same rules apply to your spouse. If you are covering a spouse under your GIC plan at retirement, he or she also has to follow the Medicare Part A, the Medicare Part B enrollment. So it applies to both. We get a lot of questions that if my spouse is over 65 and I'm under 65, what happens? GIC will allow the member who is over 65 to enroll in their own individual Medicare plan, and the member or the spouse under 65 simply stays in the plan that they have, the non-Medicare plan. We refer to that as an over and under. So there's no loss in coverage. Whoever reaches age 65 first, we enroll them in a Medicare plan, and the member can stay, or the spouse, in the non-Medicare plan. Keep in mind that only Social Security determines if you are eligible for Medicare Part A and Part B. You have to contact Social Security to find out about the eligibility. Many members say to us, well, I've worked for the Commonwealth or municipality all my life, I'm not eligible. That may be true, but GIC will require you to go and apply for Medicare benefits with Social Security. If you are not eligible, Social Security will give you a denial letter. That denial letter you simply send into the GIC that you are not eligible, and you can remain in your non-Medicare plan with GIC after retirement. So once we get that documentation, you can continue in the plan you had prior to age 65. One thing to keep in mind is that if you work for the Commonwealth and after age 65 and you have GIC benefits and you're not going to retire and you're working for the Commonwealth after age 65, GIC advises you to enroll in Medicare Part A and defer the Medicare Part B. There will be no penalty to you if you defer your coverage because you are fully covered with the Commonwealth at age 65. So simply enroll in Medicare A and defer the Part B until such time you decide to retire. When you do decide to retire, at that point, Social Security will give you 7 months to enroll in Medicare from your date of retirement. So keep that in mind. There'll be no penalty. You simply stay in the plan you have, and that 7 months after you retire, you have the option to enroll in Medicare, and it is mandatory at that point. If you are under age 65, as you approach age 65 and you receive GIC's letter, GIC knows that what Social Security will do is that you are allowed to apply for Medicare 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. So when you approach age 65, there's a 7-month window before and after. If you're going to continue working and retire after 65, there's also a 7-month window once you retire from the Commonwealth. So there's a lot of information that I'm showing here, but these are some of the areas that we get a lot of questions and there's a lot of confusion. Keep in mind that Medicare Part A and Part B is sufficient coverage for some members, but Medicare doesn't pay for everything. And many people say, well, I have Medicare, do I need GIC? The answer is, if you want full coverage, yes. Medicare Part A and Part B only cover a portion of your healthcare costs, and that you need a supplemental plan so that when Medicare leaves off from paying your claims, your supplemental plan that is offered to the Commonwealth will pick up the balance of the bills. So our plans supplement the Medicare after you retire. Under age 65, the plan you have with the Commonwealth, or if you're not eligible, pays everything in full because you have the coverage and you're not eligible for Medicare. I know there's a lot of information that we're giving you today, but I want to encourage people on our website under mass.gov/GIC. We have a video regarding people reaching age 65. We have a lot of information about the coverage, and we also have a whole retirement section with a lot of this information. For those of you that have questions in the future, we also have a retirement unit at the GIC that can help walk members through some of these questions when they think about retirement. Some things to just keep in mind is that as a retiree of the Commonwealth, you are eligible to participate in any annual enrollment thereafter you retire. Every July 1st, you can change plans, enroll, adjust your coverage, sign up for the dental. If you have a qualifying event throughout the year as a retiree, GIC has several qualifying events such as marriage, birth, divorce, that you can change your coverage if you experience one of those qualifying events, and you have a 60-day window to notify GIC of that qualifying event, and GIC will give you your options for changing your coverage at that time. So it's a lot of information. I know we have questions in the Q&A sections that we try to answer, but again, our website has a lot of information, and I'll turn it back over to you, Matt.
Thank you for that, Paul. And I do just want to acknowledge the retirement unit that's within Paul's area at the GIC. They have a tremendous amount of expertise on all of the questions that you have. We try to address as many of the common ones that we get here, but I do also want to encourage those who are listening, if you have additional questions, feel free to be in touch with us and we can walk you through those items. So before we transition to the Q&A, just a few reminders of resources that we have to share with you. And I want to take a moment to promote a new tool that we are unveiling, have been rolling out and will continue to do so, called My GIC Link. So this is an online member portal that over time we hope will replace all or most of the paper forms that the GIC has used for decades. Through My GIC Link, members can enroll in coverage, you can view your current benefits, you can make all kinds of changes, again, that in the past you had to, download a form, fill it out, send it on to us. So this is an important part of our modernization efforts and really trying to meet your all's needs as our members. All active state and municipal employees with a valid email address have access to My GIC Link as of this past November. And the portal will be rolled out to retirees in the fall of this year. So we encourage all of you to provide your preferred email address, to receive communications about the portal. There will be more information about how to register when the benefit statements arrive in your mailboxes in February. So I mentioned the annual enrollment dates at the outset, but as a reminder, next slide, the annual enrollment will start on April 6th and will run through May 4th. So as we transition to the Q&A, and we will address some questions verbally, we'll just leave this slide up, which notes some additional resources that we hope will be helpful to you. With that, I'm going to turn it over to my team. Erica, if there are specific questions that you think we can and should address verbally, I'm happy to take some of those.
Great, thanks, Matt. So the team has been fantastic at answering questions in the Q&A section. And so any answered question is available for folks to look at, any of the participants to look at while we're here today. We did get one question about when and where this presentation and the 3 videos for the 3 sessions will be placed and when they'll be placed. So the presentation and 3 recordings of the sessions that we've had this week will be up on the website, I'm hoping later today, but at the very latest, early next week. You'll be able to find all of the recordings on the GIC's YouTube page, but you'll also be able to link to them through mass.gov/GIC. So again, we hope to have the presentation and all of the videos available later today. Kind of depends on when the recordings load, but at the very latest, early next week. Another question, Matt, we get the evergreen, will the GIC consider adding a +1 option as opposed to just a family or individual?
Yeah, great question. As you know, we get this one quite frequently. So what the questioner is inquiring about here is, so we have individual plans and we have family plans. And the question is whether we would consider an individual +1 as a more affordable option for people in that situation. We have evaluated that in the past. I think we continue to evaluate that as a potential option. I think we need to be very mindful that the creation of an individual +1 plan would likely increase the premium for the family plan. So while we may be presenting a more affordable option for some, I think we need to be just mindful of the potential impacts on others of our members. So it is a strategy that we contemplate and will continue to evaluate. Thank you for the question.
Thanks, Matt. So we have a question that says here, if you have no expectation of out-of-state medical needs beyond a potential emergency during travel to visit family, vacations, etc., is there a material rationale for picking a with CIC plan option? And I think Cameron answered that in writing, but I think that's a good one to bring live. Cameron?
Yeah, that's probably a good one for Cameron. I will note while we before he answers that we are mindful of, as we go through the procurement, that the options for coverage outside of New England are fairly limited. And so that is something that we are contemplating as part of the procurement, perhaps providing some additional options there.
Thanks, Matt. I think actually we're going to kick this over to Andrew for answering. So Andrew?
Sure. The question was whether the CIC plans, the basic with CIC or Medicare with CIC, is something you would need if you were not contemplating out-of-state coverage. And CIC covers a lot more than just treatment out of state. It covers copays and that aren't covered under the basic plan. The basic plan without CIC is not, we discourage people to have it because as sort of there is a state statute that means we can't get rid of it, but it makes the plan not quite as rich as it should be otherwise. And it's a design that we have to offer because of the way the statute was written many years ago. But without CIC, it is a lot more expensive to have the basic plan when you are getting medical services.
Thanks, Andrew. So we got a couple of questions about the difference between the two FSA plans that are offered. So I think Cameron is prepared to go ahead and take those.
Morning. Yeah, we just wanted to take a little bit of time because every year, annual enrollment, we inevitably get some folks who accidentally enroll in the wrong FSA plan. So we just wanted to take this opportunity to explain the difference between the two. So down towards the bottom of the screen that's currently up is the website for Benefit Strategies. They are our FSA vendor. We have two different types of flexible spending accounts, FSAs. Unfortunately, there's going to be a lot of acronyms in this little talk. Their first FSA I'm going to talk about is commonly referred to as a medical FSA. The acronym that you will see a lot on the Benefit Strategies website is HCSA, which stands for Healthcare Savings Account. And that is intended for you to set aside money on a pre-tax basis, so you lower your payroll taxes by doing so. And then you can use that money for any eligible medical expenses for you and any dependent family members. That is different from the dependent care FSA, which is the DCAP or DCAP plan. And that is intended for child care expenses while you are working. Or it can also be used if you have a disabled dependent that you're responsible for, an adult. It can also be used for those expenses. Now, there are two separate limits for each of those plans in terms of how much you can withhold and contribute on an annual basis. The medical FSA, the HSCA limit, is going up for the next upcoming plan year from $2,750 a year to $2,850 a year. And the dependent care FSA for child care expenses will remain unchanged at $5,000. Those limits are set each year by the federal government. So that's not something we have any influence over. So, you know, just again, to sum up, a lot of people tend to, you know, every year we have folks who accidentally enroll in the dependent care expenses, even though they may not have any children young enough to qualify for childcare, thinking that, oh, that's what I need to use to pay for my family's medical expenses. That is not the case. For medical costs, you want to use the HCSA, regardless of whether that's going to be for you or any family members. So that's the one point we want to hit and remind everyone of, as well as the fact that because these are funded by payroll deductions, that you have to actively elect. So each year you have to sign on to the Benefit Strategies website and make your FSA elections for the upcoming year. And that's all I wanted to make sure everyone was aware of.
Yeah, and I would just take a moment to plug both FSAs. I think they're excellent, just financial planning tools. If you, I'm enrolled in the healthcare FSA, and it is an excellent way to just manage finances that relate to your own cost sharing. So for those of you who haven't looked at them, please take a fresh look at them. They can be really valuable. Thanks, Cameron.
Thank you.
Thank you. Let's see. Looking at questions here, there are some that are slowly rolling in. So just give me a second here.
While you're doing that, Erica, I'll just take a moment to draw attention for our members to another resource on our website that there's a specific page there that relates to COVID rapid tests. As some of you may know, there has been some federal regulation that requires health plans to cover COVID rapid tests. And for those of you who have any questions about that, I would direct you to our website where you can find some really good information there. We are continuing to update that. It's a new benefit that we are working hard to implement. So we will update that content as we have more to say.
Great, thanks, Matt. So I saw a question that came through about accessing a list of doctors on certain plans. I know that those are easily, well, maybe not easily, but accessible through our plans. So maybe Cameron or Janine, you wanted to just say a word about how to get access to those. And then I see Paul came on video. So if Paul, you wanted to jump in there after.
Yeah, I'll jump in after.
So you can find a list of providers and hospitals that are covered within your network by accessing your plan's website. And you can always call your plan directly. The information for the website and the plan's phone number is on the back of your card.
Thanks, Janine, and turning it over to Paul.
Thanks, Erica. I just wanted to, a couple of other questions that come up in the other sessions. As Matt mentioned, the benefit statements and some information that we send out every year, they're going to be going out around the middle of February to all of our members, in particularly the message about Fallon being on the benefit statement. Also, annual enrollment period, the benefit decision guides, which a lot of people look for as to what is available for other plans, coverages, copays, deductibles, and premiums. Those are expected to be posted on our website immediately prior to annual enrollment beginning. So at the end of March, beginning of April is where you will see the new benefit decision guides for the fiscal year 23, which will have all the information. Active employees can view the benefits online, and we will be mailing all retirees a benefit decision guide at home. So it comes up a couple of times when the information will be available, particularly around the people with Fallon. They want to know what the other options are. So just watch for that at the end of March, beginning of April, right before annual enrollment.
If I may, I see a couple of questions about working with multiple carriers and whether there might be some additional value to the GIC in working with fewer carriers. There was a note that, the cost sharing on the GIC plans is rather high. I would say on that last point, the GIC's cost sharing compared to what is offered in the commercial insurance market is actually quite low. I know that, again, as I noted earlier in the presentation, that for folks on modest salaries or pensions, that doesn't, that may not, it may not feel low, but they are actually quite low, quite a bit lower when compared to regular commercial insurance offered to private employees, and also even more, the coverage is more generous than other government government employer benchmarks that we use. So, I think it's just important to note that here. I wanted to address that.
Thanks, Matt. Let's see. So I see Donna is answering a question in the Q&A right now. Might be helpful for everyone. So Donna, please continue. But this individual will be turning 65 later in the year, planning to sign up for Medicare Part A. Just wondering whether retiring, sorry, hang on one second. Putting in paperwork 3 months before retirement, will it cause confusion since the date of retirement in January will be so close to Medicare sign up and state retirement rules? So I'll turn that over to Paul. Let me know if you want me to reread it because I know I just
No.
butchered that.
No, I can take that. If you're turning 65 in October of this year, remember you have 3 months before your 65th birthday to enroll in Medicare. We would, as I said, you can enroll in Medicare Part A prior to your 65th birthday. When you set your retirement date in January of 2023, you simply go back to Social Security and enroll in Medicare Part B. You have 7 months from that retirement date to get the Part B coverage. So enrolling in Part A first and then taking Part B after you retire, it's not going to be confusing. It's actually the best thing you need to do because we don't want you to enroll in Medicare Part B while you're working. Medicare doesn't pay for anything while you are actively at work. Your state insurance is primary. So simply take the A before the 65th and go back and get the B once you sign up on that retirement date, and you have that, you have 7 months.
Great, thanks, Paul. So as of right now, I see that all of the questions have been answered. So Matt, defer to you as to how to proceed here. I think we could probably wrap up, but defer to you.
Sorry, just struggling to take myself off mute there. Thank you all. Yeah, I just want to thank everyone for your attendance today, for your engagement, for the great questions.